Hi, thought I would talk about a very important topic today, hypertension, high blood pressure. I was keyed in on talking about it because of two patients I've had over the past few days. Both of them actually are men in their mid 40s to late 40s, and both with borderline hypertension, but upon further examination, may be more than borderline and may have been there for a lot longer. People of my age will recall the TV commercials about blood pressure being the silent killer. There's a reason. It's all about pressure on organs. So high blood pressure is not a disease in and of itself like a cancer, like a blocked artery. It is more of a syndrome of excess stress on organs. I like to say this, your heart on average will beat 100,000 times every day. So every time your heart beats, whatever that pressure is the pressure hitting your kidneys, hitting your brain, hitting your heart, hitting the other organs. So just as a wear and tear issue, you could imagine if 120 over 80 is this, 140 over 90 is this, and 160, and then as you can see going higher. So just like with other wear and tear issues, if you had a fire hose hitting a drywall versus a garden hose, that drywall is going to be eaten through much quicker because of the high pressure of the fire hose. So these are the analogies I like to use. The problem is that there are no symptoms. The other problem is that most people, as they age, will either be at risk of or actually develop hypertension. And even mild hypertension at any point in your life that is left untreated will increase your risk of all those above mentioned diseases I mentioned to you. So, first off, blood pressure is always going to be highest in the morning. So if you are concerned, the best time to take your blood pressure would be first thing in the morning. Certainly if you're my patient, and most of you watching this video are my patients, you know that blood pressure is something that we are able to evaluate not only with the day-to-day examination, but there are tests to look at kidney function and heart function, all the end organ issues that we look at to see if people have had high blood pressure either for a short period of time, for a longer period of time, or maybe they don't have it at all and they simply have what's called white coat hypertension or anxiety-driven hypertension. When they get it measured, it's high, but that's because of the mind-body connection. And there are also people that have fixed hypertension from high stress or from anxiety. So blood pressure comes as a cause in many different flavors, you could say. The ultimate result is always going to be the same, and that is organ damage. So the kidneys, the heart, the brain, we talked about them. A majority of people that are on kidney dialysis have high blood pressure. A majority of people that are congestive heart failure, it was due to some form of hypertension-related cardiac disease. Many people that have had strokes, other brain diseases, it's been long-standing, unremitting, and uncontrolled hypertension. So the good news is that it takes many decades for uncontrolled hypertension to actually show severe end organ effects. And so it gives everyone the opportunity to know if their blood pressure is high. And if it is, there are a lot of natural means of controlling it. The reason I have the checklist up here is because, quite honestly, the first three things right here, people that are able to check those three things generally have either well-controlled hypertension or they don't have hypertension at all. So again, I don't mind having high blood pressure. I would take 3 pills if I had to, 6 pills if I had to, anything to keep that number where it needs to be, because that number being elevated is wear and tear on my organs, and time will not be kind to a person who has high pressure hitting their organs. So looking at blood pressure not so much as a disease, but as a syndrome of a wear and tear lets us understand a little bit better. So for instance, if you have even borderline hypertension, you should have a urinalysis done simply to look for protein in the urine. That's actually the first sign potentially of kidney problems related to hypertension. So if you're my patient, you generally are going to get a yearly urinalysis to look for that. And if you're not my patient, then maybe that's something you should recommend your doctor do. There are many other ways of assessing the length that you've had high blood pressure. We mentioned some of them, looking at blood tests, looking at heart tests, things of that nature. So if there's even borderline hypertension and you're at any age, you should have it looked into and certainly see if you can remediate it naturally. How do you do that? Certainly the things we mentioned, exercise, good night's sleep. If you're gaining weight, lose weight. There's certain types of salt that may promote more hypertension. Not all salts. Mineral-rich salt, unless you have congestive heart failure, tends not to cause hypertension, whereas processed sodium chloride tends to cause hypertension. So there's a lot of methods of understanding. Number one, if you have hypertension, and if you do, it needs to be addressed at whatever age you are. And if you're my patient, we're going to talk about it. It's probably one of the most important things we're going to talk about. Again, it's a predictor of future illness, not just of what's going on today. So not having symptoms does not necessarily mean that you will not have an issue with high blood pressure. So get it checked. If it's not normal, get it checked again. Figure out how to get it down naturally with exercise. If it's safe, if you're my patient, I'll tell you if it's safe to do that. Certainly always going to be weight loss is an option for control of blood pressure. There's some natural things we can talk about, whether it's magnesium or minerals or other things. So I hope this was helpful. We'll have another video regarding hypertension soon. See you in the office.